Yeah, I'll mention it to the lads when I leave. We were just saying the clocks are 5 minutes slow.
Yeah, it might fly.
Pardon?
It might fly when you're on YouTube.
Oh, okay. Good afternoon, everybody, and thanks for joining our latest webinar. I'm Jo Walker, Chief Executive at North Somerset Council, and I'm here with Matt Lenny, Director of Public Health. And we're here to talk to you about outbreak plans. And an interesting time for us in North Somerset, because the week that the outbreak planning process was announced was the week when we were actually dealing with our own local outbreak at Western Hospital. I'm pleased to say that there was a lot of learning from that, and we've successfully come out the other side, and we've been able to put some of that learning into the development of our own outbreak plan. We're really keen to be able to answer your questions throughout the session. So if you go to slido.com, LOMP-NSC. So that's LOMP for Local Outbreak Management Plan, NSC for North Somerset Council. So slido.com, LOMP-NSC. If you ask your questions, then we'll deal with them at the end of the presentation. But without further ado, I'm going to hand over to Matt Lenny to take us through the presentation.
Thank you, Jo. Good afternoon, everyone. So if we move to slide 1, which talks a little bit about the local outbreak plan development process. So there's a recognition there that the origin of these plans, and these are plans for all local authorities, that's upper tier or unitary authorities. So back in towards the end of May, the government asked us to produce plans with a deadline of the end of June. So we will be publishing our plan tomorrow in order to meet that deadline. Alongside the requirement to produce the plan, there was the establishment of a good practice network, and this is based on 11 councils who were in the first wave of developing a plan, and some of the learning from those areas has been incorporated alongside our own learning, as Jo's recognised, through the localised outbreak we had connected to Western Hospital. So within the southwest, within our region, the good practice area has been Devon, working alongside Cornwall, and we've been working with those colleagues and indeed colleagues across the southwest in the development of this plan. So what we have overall is a framework which sets out some principles, talks about responsibilities and what practical actions people need to take in the case of an outbreak. And so that's how we've set up our plan. It's trying to talk about an overall approach that we need to develop and implement, but that the actual detail will change over time as the situation changes, but we have a really sound plan to work from. And then this slide deck is just giving it an overview, and we can move on a bit now, I think, onto the next session. So just to talk about the areas that the outbreak plan covers, and there's 5 identified here through the national process. One is around capacity, because as we've seen over recent months, the development of COVID-19 and the pandemic has meant that we need to build and flex capacity in all kinds of ways to meet the new challenge facing our communities. So this is something around us needing to be able to develop our relationship and work well with our communities. We also need to put into place really practical items like testing for the virus. That includes both testing for the virus and antibody testing now. Contact tracing, so identifying those individuals who have the virus and who might be at additional risk, and therefore trying to stop the spread of the virus. Infection control measures, that will be things like personal protective equipment in certain settings. That's about good hygiene practice. That's about certain other methods like social distancing, which we're all trying to do every day in our lives. We also need to look at support for vulnerable people, because we know that this virus is affecting some sections of society more than others. For example, the increased risk of mortality in older people. And about enforcement. So that's just about working with our different settings, our different organisations, the likes of local businesses, in helping them to be able to meet the new guidance and to do that effectively. And then any other additional specialist expertise that we might require. So for example, that might be working with colleagues in Public Health England who have particular skills that we need to avail of in certain situations. So we develop our capacity as part of our operational response, but we recognise that all of the actions that have succeeded so far and will succeed in the future around mitigating the impact of COVID is very much around working with everybody in our community, so all of our stakeholders. So that's working directly with the public and using lots of different mechanisms by which we can talk to the public, listen to the public, and identify ways in which we can work together. We work with employers, we work with our key sort of technical partners, if you like, the likes of Public Health England, who provide specialist advice and additional support. Our colleagues in the NHS, who are on the front line of dealing with some of the impacts of COVID-19, as well as our care community as well, the care providers. Different facilities, noticing that there are particular settings which are at increased risk, places like schools, and as we found out locally, hospitals can be a source of infection. There is something called the Joint Biosecurity Centre, which is a national body which has been set up to try and provide more information and intelligence to regional and local planning about what's going on in that area and any early signs of potential risk and how we might be able to respond to that appropriately. We obviously work all the way through to national government and get support from national government where we need it. We need to work with our local media, who are key in terms of providing messaging and support in explaining information and different issues to the public. And of course, working with our community, faith and voluntary sector. So realising that there's a whole multiple network out there of organisations and groups who are very close to people, who are very trusted and provide great support, and we want to do as much as we can to provide them with the information so that they can continue to do the excellent job that they've been doing in supporting people through the pandemic. The third section here talks about scale. So this is recognising that when we talk about communicable disease outbreaks, well, we have those regularly. COVID-19 is a different scale and a different intensity to anything we've ever seen before. But if you take other outbreaks, things like measles or tuberculosis, we would always put into place appropriate measures to try and protect the public and control the spread of that disease. But what we're seeing now is we're having to work in multiple settings, in multiple channels, and work with multiple stakeholders to make that work well. And we need the ability to deal with the here and now, but also scale up if we were to have a particular problem facing our local population. And how we would scale up is important. So that's working at the local level, but also working collaboratively with our colleagues at regional and national level as well, to make sure that we get the right resources in the right place at the right time. So there is about coordination there, and is about having a plan which describes how we would go about doing that. So moving on to integration and delivery. So this is about the additional resources and integrating that into the way we would normally respond to any outbreak of disease. So the new NHS Test and Trace facility, which is providing really important support in working with those people who've tested positive for the virus and then trying to trace through and find those individuals who were in their close contact within the infectious period. And then you can identify those people, inform them, and they can take appropriate steps to mitigate the risk of the virus spreading further. We've also got different work around support and assurance. So, for example, the health protection team regionally from Public Health England do an excellent job working with us in providing specialist support. And they can call on different parts of Public Health England to help us. For example, they have a field epidemiology service which does a lot of work where they map the numbers and they can give us some intelligence to guide our future actions. So what we're trying to do now is to integrate the different sources of data. So some of that's things about number of cases, about impacts in certain places. It can also try and bring in the things like the Joint Biosecurity Centre are doing to try and link different data sources about everyday life and what clues that's giving us. And what we want to do is to bring that together into a shared understanding of what's going on in North Somerset and what's going on in North Somerset in the context of what's happening regionally and nationally, so we can plan together and make sure that we work together effectively. And then the last part of this slide talks about communications and engagement, which of course is really important, and we've seen that in terms of public messaging from the start of the pandemic, about how important it is to try and give out clear, understandable and actionable messages for people, because it's only together that we do our best to try and minimise the impact of the virus. So we have established communication strategy for our work around COVID. We're working within that. We're always looking to build on those contacts, to extend the spread of the messaging. We've got lots of good examples of how that's helped us up to now, and we hope to continue in that vein. And to be as proactive as we can be in working with others to spread key messages and to listen to the feedback that comes from people and to get better and better at doing that as we go along. So that's covering those 5 areas. Moving on to the next slide. Within each of the local outbreak control plans, there are 7 areas that have been identified, 7 themes for each local authority to provide a plan and to describe what we're doing in those areas. And they're done I'll just quickly run through the reasons. So the first one is about essentially higher risk settings when we talk about care homes and schools. So care homes obviously were quite high profile at the beginning of the outbreak. We had a lot of concentration of cases and sadly a large number of deaths associated with care homes. Over time that situation has improved and the work that has been done from within the council and by providers has been really strong in terms of trying to wrap around and support those vulnerable people as effectively as possible. We've also been in good dialogue with schools, trying to support them as they make decisions about how they open and how they support both pupils and staff within those settings. So we'll continue to plan in that way and to build on the work that's happened so far and try and work really effectively. And if there are particular cases where we get clusters of cases in those settings, we will get in and alongside those settings and work with them to try and manage that effectively. So outside of those 2, there's also workplaces. So workplaces have been in the news recently around certain types of settings, like meat packing settings and others. Now that's primarily because of the close proximity in which those industries are set up. People work quite closely beside each other, so the social distancing is harder to do. Plus you can get additional risk factors. There was an interesting one in Australia recently where a workplace had done everything right, but they got a number of cases, and that was due to a shared lighter passed around at cigarette breaks. So there are so many different ways risk can be transferred, and it's trying to stay alert to that and work with workplaces to just risk assess every aspect of social contact and coming in and out of facility and what surfaces you touch, those sorts of things. So we'll work with workplaces, we'll work with communities, so we may have high risk around certain age groups, certain characteristics, and if there are particular locations that become hotspots for infection, where we see cases go up, then it is about getting alongside the people who really understand that location and that community. So that will be our elected members, it will be town and parish councils, it will also be the voluntary and community sector and other kind of community leaders, for example, head teachers or local GPs, who will be able to give us ideas about what we need to do and how we can work most effectively in that place to try and mitigate the impact. The third theme that we've been asked to look at, so this is about the integration between local and national approaches. So at the moment we've got mobile testing unit and we've got a permanent testing unit in Bristol Airport, which is the sort of regional centre for testing. We've got a mobile unit in Weston-super-Mare, and we should have a new mobile unit coming online in Clevedon tomorrow. So that's extending the spread of testing opportunities for people. And testing is really important because when you test, not only do you confirm an infection, but you also start the process of contact tracing. So you then try and prevent the further spread of the virus. Because lots of people are asymptomatic when they're testing positive or very mild symptoms, it's really important that if you experience any symptoms at all, then do put yourself forward for a test. If we can identify early, then we can take appropriate action to help reduce the risk for you, your family, your friends, your other contacts. So the testing has developed, and now the contact tracing, which is point number 4 in the theme there. So there's a national contact tracing process, but we also have a more localised system in complex settings. So that will be led by Public Health England, working with us in the Public Health and Regulatory Services team. But we will get alongside that setting and try and make sure that we can help them work with, for example, their workforce or their pupils or their residents, to make sure that we are seeing our way through all of the contacts and those people are supported appropriately. The 5th area is data integration. So as I said a bit before, lots of sources of data. It's trying to see your way through that and to have a number of key indicators. And within the outbreak plan, there will be an example of a public-facing dashboard, essentially, so that people can keep an eye on some of the key indicators and how we can try and make sure that we're staying on top of any signs of a rising number of cases or any other factors that might, in the future, create a rising number of cases or bigger impacts. Number 6 is about vulnerable people. So I mentioned that before. We know that there will be higher risk amongst some individuals in terms of the virus itself, although it's primarily more risky for older people and people with long-term conditions. It's not exclusively. We know that the virus is less likely to spread, probably, and less impact amongst younger people, but it doesn't mean that it doesn't have impact. So really, this is a case of saying to people, everybody has to act like they may potentially have the virus, and anybody around them may potentially have the virus. But within that, there's additional sources of support and understanding and help for people who are perhaps more vulnerable and who may find it harder to operate. We've seen lots of good work around the shielded population and through the voluntary community sector, through the North Somerset Together approach. Some fantastic work's been going on about reaching out to local need and providing a support that's hugely valued by those individuals receiving it. And finally, the last bit is about local boards. So this is about having a governance process for the implementation and the monitoring of this plan. And so to do that, we will have a local outbreak engagement board, which will provide an overall community leadership around this, because it is a plan for the community. Although it's a responsibility of the local authority, it's about everybody in the place of North Somerset feeling like they've got a stake in this, because the success depends on all of us playing our part. So it's setting it up in that way. So although we have a technical response around health protection, we want to make sure it's set in the context of a relationship between everybody supporting each other to try and get to the same goal. So I think those are the main points on the themes. So moving on to what the components are. So what it should be is a relatively easily understood document. It should be written in such a way that sets out the framework for how we're going to respond. We want it to be accessible for decision makers and a wide range of stakeholders, so that people feel like we've got a good grip on what's happening at the moment and that we can adapt and respond appropriately as things progress around the pandemic. In terms of the content, some of those things I've already covered, so I won't go through them again now, but around governance, around processes, around communications and engagement. So it restates all of the things we should have in place. And then certain tools we are being given nationally in terms of data sources and different templates for doing things, but also our own, which we've developed through our own experience of managing an outbreak, but also through our long experience of dealing with outbreaks of communicable disease. So using some of the tools that already exist and adapting them for the specifics of COVID-19. And that will sit within an overall national assurance and support framework. So we will be in communication with colleagues at regional and national level to describe what's going on in North Somerset, just like all the other local authorities will be doing the same. So moving on to the next slide, this is it's quite a busy slide, but it's a way of trying to show the whole thing in one space. So I'll try and talk you through it as best I can, and then hopefully it'll make a bit more sense. So what we've got really here is 3 domains that we're thinking about where our activity needs to be right. So if you go to the top left section, which is sectioned off, it says health protection response as an overall label. So this is the way in which we would normally respond to any outbreak, or for example, a flu outbreak or whatever it might be. And overall, we have a health protection board, which is a number of agencies, which is chaired by myself. And we go through our operational planning. We think about all of the risk elements. We work out how to deploy our resources most effectively. And that's working with colleagues in Public Health England and primarily within the NHS, but not exclusively within the NHS, to try and make sure that we've got our resources in the right place. So that's about a group of professionals working in established patterns. And then above that, if you look at the national level, so the boxes in green, it also recognises we've got the new NHS Test and Trace programme, which gives us vital support in terms of being able to mitigate the spread of the virus, and the Joint Biosecurity Centre, which gives us ongoing intelligence to inform our actions. So that's a sort of operational bit in terms of responding to an outbreak. In the sort of top right bit, it's also a recognition that the local authority sits within a number of structures, particularly at regional level or sub-regional level, where we have the Department of Health and Social Care and Public Health England working together as a regional hub, leading up to the National Control Centre, but also our long-established mechanisms for the Local Resilience Forum, the LRF, which has a strategic and a tactical response level. So that's where we would link with, for example, colleagues in police and fire, the ambulance service, colleagues in the highways agency, all kinds of agencies involved there. So that's thinking about how you would respond in a place to a particular incident. What we have is, in a pandemic, is a long ongoing incident, but we would use those structures appropriately to make sure we got resources in the right place. Finally, the third bit, which is captured community response, is recognising that for North Somerset as a place, we also have our sort of operational response bit, which is led from within the council by the corporate leadership team and the executive as the leading elected members. We also have a tactical group which does this sort of operational stuff, the pandemic working group. And then we will have our engagement board, which will provide that overall community leadership and coordination, which will be a sort of welcome focal point for some of this work. And then linking into that will be our town and parish councils, our community, so that's our public in all of its different forms, our elected members as a whole body, and our voluntary and community organisations, just as 4 areas where we reach out into the community and have some proper conversation and dialogue about what we're going to do and how we're going to do it. And what we've got along the bottom there is just some enablers, and they work across all of those areas. So what we want to get to, which today is about open reporting about what we're doing and why. We want to try and coordinate our resources, because we should be doing that to try and get the best possible response. It's about standard operating. So when I talked about the health protection response, there's lots of standard operating processes. So if you use those processes that are tried and tested, you generally get the best results, and that's what we're interested in. And then finally about communication flows. So that's trying to make sure that we get the information flowing between these different boxes on the picture here to make sure that everybody feels well informed, and when we need to step up our action, we've got the means to be able to do that. So that's an overview of that slide. Moving on to the next slide, this is just talking a little bit about settings and groups of people that we're interested in. So these are examples, but just so you can see them in some context. So for example, healthcare settings, and what we've got to the right of that is just showing about different ways in which we're already thinking about the needs of those groups or settings, and also how we're trying to extend that as well. So we work with colleagues across Bristol, North Somerset and South Gloucestershire really regularly. We've been part of the whole response process in the health and care world, and we work very closely with our locality groups within North Somerset as well. So with the care homes, we have a multi-agency group in place which provides the wraparound support, and we would always focus on that individual home needs and making sure that we've got a response to cases, an effective response to support them as appropriately as we can, and lots of work has gone into that. Schools and colleges, so there's a range of support from the council that comes through the team that works with schools, home to school transport, all kinds of areas. And also recognising in here and the early years section, for example, we've had really good work with our community health provider, Serona, which is now repurposing some of their school nursing and health visiting support to provide an active kind of advice desk for those settings. And we've seen over the last week that's been really appreciated in being able to provide some practical support and advice for those settings, in making sure they've got everything covered in the right way, and they've got a professional who can provide a bit more support and advice if they need it. So moving on to businesses, lots of support has gone in there, practical support which has come through some of the government funding for businesses, but also health and safety support, trading standards advice. So this is about making sure everybody's operating in a safe environment, both for employees and for visitors coming into those settings. And then we move into sort of more hospitality areas, so pubs and clubs, restaurants, hotels, camping, tourism destinations. We're seeing a lot more about the opening up of the possibility of people being able to move around and stay in different places. So again, we have those established links. So that's through our colleagues in licensing and the Food and Health and Safety Advice Service. And they will continue to support and have provided really good support to those settings. And it's about working with them to try and make sure they've got the best possible advice alongside the national guidance. We also have a concentration around the airport within North Somerset and other forms of transport, which is another potential source of infection risk. And we're working within some of the national framework around that, the port health approach, which is being supported by Public Health England. And then there's just 3 examples there of certain population groups. So social care users recognising that it's not just people within care homes, but we've got people in home settings and accessing support in different ways. We really want to be able to identify their needs and deal appropriately with those. And that's where the links with the voluntary and community sector be really important, because they'll probably also be working with those individuals in different ways, whether that's directly with the individual or perhaps with their carers. We have a shielded population. And there'll be ongoing support for that. There is some national announcements about how that might change in terms of advice, but what we do recognise is that those individuals are still vulnerable, so we want to maintain ongoing communication and support for those people. And then, for example, the homeless support, so particular support's been given there to try and help people to move out of a sort of street homeless situation, but we're recognising that there's ongoing vulnerabilities there, so we want to be able to be proactive and try and help manage and make sustainable changes where some of the changes in response to COVID have come in. This next slide is just to emphasise again about the sort of standard approaches in terms of health protection. So what you would start from in the top there is you do your surveillance, your epidemiology and your insights, so you're understanding what's going on in your population. Look at evidence of any changes, so do you need to adapt what you're doing? Then you think about what actions you need to take. You'll implement those and you'll make sure you've got the right resources, and you might need to commission a bit of extra support or service to do that. And then you do your assurance, your evaluation, and then you do iteration. So it's recognising that we're always working within that circle to try and plan for health protection needs. So the pandemic sits within that overall framework of action. So if we keep thinking in that way, we're using our training, our understanding, the right tools, and just adapting them to the situation that we're in, but recognising this is a situation like no other, really, in terms of the way we've had to respond. And then finally, just moving into some of the resources that are going into some of this process as well. So it's about recognising we've got pre-existing outbreak plans and strategies. So at the start of this, the pandemic, we dusted off a lot of our existing plans around pandemic flu. A lot of those were relevant in some areas. They had to be adapted, but at least they gave us a framework from which to develop our plan. Likewise, our existing comms and engagement channels, it's a build-up of that rather than a start from scratch. We look for examples of good practice from elsewhere, so we'll take that from other parts of this country, we'll take it from other countries as well. So if we see ways in which we can do things more effectively, then we'll certainly make the most of those. We'll pick up on the national guidance as well, so that's ever-changing. So it's recognising within this plan it sets an overall framework, but we will be constantly adapting to new guidance, whether that's about the way in which we live our lives, or whether that's more technical guidance, as we learn more about COVID-19. It's important to recognise that it's a novel virus, therefore we are building an understanding as we go. We don't have a full textbook of what to do in certain situations, or how the virus is going to behave, or things like how immunity is going to be conferred on people. So it is about keeping our eye on the guidance all the time and adapting to that, and then trying to produce good summaries for people in terms of frequently asked questions, key definitions, explanations of what's going on, so that people can use those new guidance effectively. And then finally, it's about networks that we have that exist. So we've already talked about the Good Practice Network, but we have other support organisations like the Association of Directors of Public Health, which I'm part of. We also have a Directors of Public Health network for the South West, working very closely with our colleagues in Public Health England. These are really good sources of sharing advice, support, tools, those sorts of things. So it is about being adaptive and learning off others. We can get access to different experts. We've got the Local Government Association as well, which is providing really good support for local authorities in lots of ways. So this is about connecting the response to the specific health protection threat to all the other aspects of society that we're thinking about at the moment, particularly around recovery and renewal, how can we plan for that as part of then also being ready to respond if we had a spike in cases and an outbreak that we had to deal with. And then finally is thinking about having some standard operating plans in place, processes, and we're looking at developing a series of action cards for different types of settings, different types of scenarios, and we'll be doing that with colleagues across the Southwest so that we have a common approach, so then that way it's much easier for people to think about what their role is and how we can respond effectively. And again, back to that cycle, we'll be constantly adapting that and learning from that as we implement any of those operating procedures. So, just finally to say, if you want to know more, that the plan will be published tomorrow online. The web address is n-somerset.gov.uk/LOMP, Local Outbreak Management Plan. That's where it will be cited. And what we'll have in there is the final version of the plan. We'll have an equalities impact assessment. We'll have an example of the data dashboard, so that's the sort of thing that everybody could look at and understand what's going on. And we'll have a simple narrative as well, so you can see just in one page broadly what we're trying to do and why. So that's a run through the slides. Hopefully that's been useful, and I'm very happy to take some questions.
So Matt, thanks for that. That's great. We've got lots of questions, and the first question, which is the most popular at the moment, is from Councillor Jeff Richardson, asking about whether we'll be keeping physical stocks, so stocks of physical resources like PPE to cover outbreaks. So quite an interesting one there.
Yeah, so the way the PPE supply has worked is, so that's been partly through the Local Resilience Forum as part, and partly through the local authority retaining some stock. So we do have some, but it's part of... Sorry, I just realised I didn't put my microphone on. Apologies. So it is about having some stocks available so that we're able to respond to ongoing needs and additional requirements if that's what's needed. But it is about trying to make sure that that's an efficient use of those stocks. So what we do have as part of our overall national planning is working with some of our national colleagues about how you would scale up for a particular local area if that was required at a particular moment. Some of this is about not every local authority holding huge stocks of materials which may or may not be used. It's about getting quick access to those materials through our local ordering processes, through national ordering processes, and even mutual aid if that's required. So that goes for stock, but that also goes for people who can provide advice and support. That goes for expertise, all of those things. So it's a flexible approach, but we will always have some physical resources in place, and we will continue to monitor need and respond to need as effectively as we can. So the answer is yes, but not to a huge extent, I suppose.
And I guess, Matt, it really depends on where the outbreak happens. So if the outbreak, for instance, happened as it did do in a hospital setting or a care home setting, a health setting, then actually they would have stocks of PPE, and there might be particular types of PPE as well, just to reassure councillors. Is that correct?
Yeah, that's right. And so if it was in a different type of setting, say like a certain type of business setting, say a factory, it would be probably a slightly different approach anyway, because you'd be going in, you'd be trying to identify who was affected, do the tracing out from there about who else might be affected. It would be more about testing and isolation rather than necessarily routine use of PPE. You might need to review social distancing policy or risk assess the setting of the workplace. It could be about social distancing. It could be about certain key touch points, I mean literally touch points coming through a building which are higher risk. So you would risk assess and then act accordingly. Sometimes it's PPE and other equipment, sometimes it's something a bit different. Yeah.
Well, moving on now, there's some questions here, Matt, about track and trace. So the first one is a question from Councillor Keating around how confident are we that track and trace data is robust enough to allow a local lockdown if needed?
So I think with track and trace, it's an emerging resource, it's an emerging picture, because it takes a bit of time to build up the intelligence about what's going on in the population. It's only been online for about a month, so it's not a particularly long period of time. And what we're seeing in other countries who've had those systems in place for a longer period of time is, as time goes on, you've got more and more understanding of where you think the infection is, and we're also talking about, we're identifying some of the infection, we're not identifying all of it. So we will use as much as we can, but it won't be the only source of data. We'll also be looking at what's been going on in terms of use of, say, for example, NHS facilities. We'll be looking at connections between cases as well. So there'll be a range of data sources that you would look at before you would be able to identify a particular outbreak. And if we were talking about local lockdown, I suppose it all depends on what the definition of local lockdown is. And what you'd want to do is really get to the data to understand what's going on, and then you would try and think about the most appropriate control measures that you would put in place to respond to that particular need. So is it about, we talked a bit about the workplace there and stopping people coming to work, having a certain period of time where those cases stop being infectious and you've closed it down? Or is it about going into somewhere like a school or a care home, where it may be, particularly in a care home, where it might have to be a more active process of lockdown because you've got residents in that setting as opposed to people coming in and out of it? So I think the lockdown process it's all about risk assessment of the situation that's in front of you. So back to the principles of who's been infected, what's the risk to others, and then you draw your circle around that, and then you think about what you would do within that space. If we had a geography affected, even within a geography, we'd be trying to work out, well, what were the key points of transmission? Was that based around a school? Was it based around a place of worship, for example? It could be all kinds of things that you need to be looking at. So you would risk assess all of those settings and then try and work out what the most effective thing to do is. But most of that really is down to the constant messaging for the public around social distancing, about good hand hygiene, about early reporting of symptoms. All of those things remain the most effective things that everybody can do, as well as responding to a specific issue in a specific place. So I think the more we can all do ourselves to maintain those good behaviours, the best chance we've got of not having more serious consequences.
There's quite a lot of questions about lockdown, but I'll maybe come back to that in a minute. If we just stick with test and trace at the moment, we've got another question here from Councillor Holland around what evidence do we have that test and trace is actually working? So I think there's a lot of concern about, is it working, is it doing what we're expecting it to do? And I wonder whether it would be quite interesting, because we haven't had a chance to have a webinar since we've had a local outbreak, maybe to also explain about some of the work that was done around our outbreak at Weston.
Yeah, so in terms of test and trace, what we are seeing is that the cases identified in North Somerset since that system's been in place, we can see that people, it is reliant on individuals to provide information about where they've been and what they've done, so that you can then try and follow that on and find the people who may have been also infected. But for those people where the contacts are given, then they are following those through and consistently trying to get in contact with those people. Now, with any new process, there's always a bit of bedding in, there's a bit of getting used to it, there's a bit of getting used to get the system to work effectively, but it's also a system for us. This is something that we as a general public have never used before. So it's quite a process to think, right, okay, I need to listen to that call and I need to respond appropriately. So it's as good as the response as well sometimes. It's not just about the system, it's about the effectiveness of the response from the individuals who are contacted. So I'd really encourage people to listen carefully to any advice that's given through that process. But what we learned and what was helpful for us in this situation at Weston Hospital was that we had a resource there to get in alongside the identification of all of those cases. Now, within the hospital setting, the individual patients was easier to manage because they are resident within that setting, but those members of staff who tested positive and then following that extent back out into the community, it was a useful service to be able to do that, so that there was support to identify those additional people who may be at risk, and that I helped to identify additional cases as well, and then therefore stop additional risk from those additional cases going to other people as well. So it's one of the tools. It's not the only tool. But it is an important part of ultimately trying to get a real grip on what's going on in our community in terms of numbers of cases and trying to limit the spread. And I think we just have to keep going. And if we had a particular issue in a setting, we would again assess whether additional test and trace resources are required, and that's something that we could potentially support from within the Public Health Reg Services team. and also with our colleagues in Public Health England. So I think it's a value and will become of increasing value over time.
And I think that touches on one of the questions we've been asked around having a local test and trace system. So am I hearing that there's kind of a balance to be had with the national and the local one as well?
There is, and it's sort of, and I'd even put regional in that mix as well, because some of this is about not developing or you want to make sure you've got a flexible resource. So we work with Public Health England at a regional level. Their health protection team works at that regional level across the southwest, and that works really well because you have a concentration of skills, experience, resources that can adapt to the needs of different settings. And we would look to work with Public Health England to make sure we had the right resources in the right place. So that would be a sort of, and we are looking at more of the standard operating procedures that we can use to try and articulate what that looks like in practice, which will underpin some of the delivery of this plan. So we would have the resources within our own team locally, but we can work with Public Health England regionally to make sure that we get the right support in the right place. So it is, because this is a developing area of work, we're looking at how we can do that most sensibly. And also, back to the point I made about mutual aid as well. You know, we don't exist as an island. We work alongside our colleagues in neighbouring local authorities routinely on these sorts of things. And if there was a particular issue, so for example, when we had the Western outbreak here, you know, I was contacted by neighbouring directors of public health with offers of support. We didn't need it at that stage, but it was really welcome that we work in that kind of public health family way of looking to make sure that we step in and help each other when we need it. So there are a number of ways we could respond to that, but I would feel confident that we would have enough ways to be able to deal with things effectively.
And what I'm hearing and sensing throughout the presentation is the importance of data. So there's a question here, a few questions on the theme of data. So the first one from Councillor Steve Bridger is, do we have the data? Do we feel we have enough of the data we need?
So we have data obviously on the number of cases, we have data about deaths, we have data about the settings in which some of those cases and deaths are taking place. With test and trace, we're getting an increasing source of data about you know, where the spread has come from in terms of index cases and then potential additional risk. But it's an ongoing picture. What we do know, and I suppose this is the thing about this virus, because it can be quite hard to detect, even in people who you would expect to have really good understanding of what the symptoms are of the virus, they may not understand that's what it was when they've had it or when they have it. So it's never going to be a perfect system of saying we really know where every case of COVID-19 is prevalent in our population. So I suppose the key thing is about, but what do you do then to try and stop the spread of the virus? And what you do is still the same things around social distancing, good hygiene, reporting if you feel you've got any symptoms, and listening to the advice that's given to you very carefully and following it. So the control is still the same, but the data will grow over time. I think with our colleagues in Public Health England, who provide a lot of the specialist support around the data, we do have access to really good support in terms of analysis. We can also put it alongside any data that we have within the local authority. So I think it's a developing picture. It's not perfect, but it probably never will be. It's also about thinking about the practical steps, the call to action to each of us, what we can do, in the same way that certain settings will put in place additional control measures. For example, the really good work that's been done in schools around implementing the national guidance about how to manage those settings safely. So we pay attention to the particular guidance, but the general messaging applies to us all, definitely.
And an interesting one here from Councillor Gibbons, who's maybe controversially picked up that Hackney's DPH, the your equivalent there, is saying that councils would be limited in investigating outbreaks due to a lack of helpful data on local cases from the NHS's contact traces. And she's asking whether that's true. What's your comment on that, without wanting to possibly disagree with a colleague or not?
Well, I think there's, it depends how you look at it, really. So I have said that the data isn't perfect. So you would always say that if you're investigating outbreaks, you always want perfect data. Of course you do, because then that makes you absolutely certain about what you're dealing with and how to respond to it. But I wouldn't agree that we couldn't investigate outbreaks, because if we see a cluster of cases emerging in a setting, we would go in and do additional understanding of what was going on in that setting to create that additional risk. So that's not just about waiting for test and trace data to come nationally. That's about our local intelligence, about our local working relationships. For example, so if it was in a school, we have our schools team within the local authority, really good working relationships with the schools. We've got a great network of head teachers. We would be able to talk to heads or to governing bodies about what was going on in their setting. So it's about getting in and alongside people rather than sitting back and waiting for perfect data, I think. You can have a certain amount which gives you an idea of what's going on, and then maybe you need to go and do a bit of extra investigation. So my view would be if someone's looking for some advice and support, we can look at data and then we will do our best to try and help them.
And you've touched on schools there, and there is a question, another great question from Councillor Griggs around how robust the communication between all the schools and the different settings is. So I'm reading into that, the communication between us and the different schools across the footprint.
Yeah, so we've been providing updates. Some of that has been coming through the sort of regular updates that come from here and the notice board that goes out to all schools. That's also been flagging up the latest guidance that's been developed, and that's an ongoing process. So colleagues in Public Health England developing that guidance to try and provide practical support and advice for people in terms of managing those settings. We've also tried to support schools in terms of holding some additional webinars where we've had direct conversation with head teachers. So that was between myself and Sheila Smith, our Director of People and Communities, to not just share information, but to create a two-way channel of communication, to, a bit like we're doing now, to receive questions and to try and respond to those effectively. And we've said that we're willing to continue in that vein, that the door is open, and if schools, we'll do proactive work, but also if there's additional needs, that we'll do our best to try and accommodate those. So it is about us working together, always willing to hear about new ideas and new ways that we could do that more effectively, but we are trying to be proactive in that space as well.
Yeah, and hugely grateful for all the schools and all the work that they've done to keep going throughout the pandemic. But also more recently, when we did have the local outbreak around Western Hospital, I know that you and Sheila had that dialogue with schools, which was really helpful. And of course, I think we just need to acknowledge it was really difficult for us, because actually that outbreak happened at a time when lots of schools were going back after half-term break, and different. As we were getting data, I think this is the other thing, is I suppose my experience was the speed at which we were getting data and having to turn around decisions meant very late in the day we were having to give a view around schools returning, which is quite difficult, isn't it, I think?
It is. It's trying to make sure that you're giving advice on a really sound basis. You don't want to jump in and just do something for the sake of doing it. You want to understand what's going on behind the scenes, what the data's telling you, and provide something that is meaningful for people. But I think if you have the open discussion as part of that process, and you can say, well, this is what we know at the moment, and this is what we think we can tell you on the basis, but in X amount of time, whether that's 2 days, a week or whatever, we think we'll be at this stage, and then we can share that with you, and then we'll have another conversation about what the right thing to do is based on that further information. So it's just about being honest about that. In terms of an outbreak, you don't arrive with all the information at the start. You have to pick up as you go along. But I think as long as you're open about that and you try and communicate effectively as you go along, then hopefully people will feel like they're getting the right support.
Great. So loads of questions about an outbreak itself in terms of control, lockdown. So it's been really interesting watching the national picture as it emerges. There's been lots, I guess, and it's referred to later on in a question around Leicester over the weekend, and clearly a very different type of outbreak to the one we had, in so much as I understand it, that happened in a meat processing plant or a packaging plant, and in effect, lots of speculation about what a physical lockdown looks like. So the first question around that kind of a lockdown is from Councillor Jeff Richardson, which is great. It's asking who has the overall control of an outbreak. So this is before, I guess, we get into lockdown, but in terms of control of an outbreak, do you want to just bring us back maybe to that governance slide in terms of, because for me, I think that's where it's at for me.
Yeah, I think you're right. So I think in terms of, there's an operational response to an outbreak, which is the sort of health protection response, And that sort of very much sits at my doorstep in terms of the Director of Public Health has certain responsibilities under the Health and Social Care Act to protect the health of the population. But that can only be done in the sense of a community agreed and a community sponsored response. So you might need to move relatively quickly to deal with the issue in hand, but you want to do that in the context of taking stakeholders with you and creating community understanding and support for whatever it is that you're trying to do. Because generally you will need to take the community with you. You can't just tell people to do things, you need to make people feel like, yeah, I'm happy with that, and yeah, I'm going to take that response. So I think in terms of overall control, it will centre on the local authority as the home for looking after the place of North Somerset, but it's about making sure that all the right resources are there to support that outbreak plan, whether that's from colleagues in the health service, whether that's from Public Health England, it could be other parts of society, back to the local resilience forum and all of those agencies that work in that setting. So we will be trying to make sure that we got all of the right players around the table to be able to help us do our response. So in terms of ownership, it probably sits within the local authority, but only on behalf of and for its local community. It's
a shared response.
It's got to be about getting the right outcomes for those individuals in our community who might be affected. And that's our guiding principle. You do the right thing by the public, and then if you keep that in your mind in the middle of an outbreak response, you'll probably not go too far wrong.
And another great question in terms of, will we need additional powers to enforce the local lockdown? So I think this idea of a physical lockdown is really interesting. You know, it did come up when we were talking about our own outbreak. Sometimes I find it more challenging, actually. How do we physically lock down? Can you physically put barriers around a place? I think it's much more challenging. And certainly when we started to look at powers to do that, some of those powers, of course, are very limited. So, you know, I don't know whether you've got a view on powers, but certainly my experience was that, you know, we don't actually even have the power to enforce schools to close. No. We can advise and steer, but that's at best currently what we can do. There's another question further down from Councillor Solomon about whether we have the powers to shut down our beaches. And again, similarly, I think, you know, there's a challenge around whether we could actually do that, particularly given the vast length of beach that we have. Beautiful as it is, you know, it'd be quite challenging, I would have thought, to close that down.
Yeah.
And any thoughts or any discussion that you've had as directors across the region on that?
So it's a live issue. So, for example, Bournemouth was, you know, very much in the headlines recently, and I know the Director of Public Health in Bournemouth well, and that was a really challenging moment for them, and they had to declare a major incident. But actually, when you come back to it in terms of what are our powers, they are very limited. So we'd have to be thinking about, well, you know, would there be a change in national policy? Would there be legislation to enable us to take on new powers? But of course, if you close large facilities down like a beach, then there's impacts as well. So is there impacts on people's freedom of movement? Is there impacts on business? So there's a lot of consequences to an action like that, and that would have to be thought through quite carefully. I suppose I would say that primarily what we're trying to do, and this is difficult, but I think it's the place that we have to start, is can we build and maintain public confidence in the actions that we're asking people to work with us on? So can we ask people to continue with the good behaviours that lots of people have really stuck through challenging times, and even in this time in easing of lockdown, not lose sight of the things that matter most around social distancing and hygiene and early reporting of symptoms. So, you know, we can't lose sight of those things that have got us to the place where we are now, which is infection rates coming right down, numbers of deaths coming right down. You know, we don't want to go back to where we were a few months ago. So you can have large powers, but just having large powers in themselves generally don't work. It is about public confidence and trust. And so that's about getting national and local messaging right to try and get people to work with us rather than just saying we're going to stop you from doing something. So it needs to be both, I think.
And I guess it is an ongoing national debate, isn't it? And, one that we are all closely watching with interest in terms of Leicester and their experience, because I think, there clearly is a dialogue happening between Leicester and government around what's happening there. So we'll watch that with interest and see whether that does result in any more devolved powers in the event of a lockdown. Back to that governance point again then. So who takes that final decision on lockdown? So I think what I was hearing is it's the board, the Outbreak board.
I think that's the thing. Now, there's that's the sort of parent, if you like, of the overall plan. Underneath that, there would be, I think it's about providing some clear recommendations, some really good information sources to justify those recommendations. That would be based on the data that we have, on the learning that we may have from any other similar types of outbreaks in other parts of the country, what was effective and why, plus the standard approaches that we'd be looking to. So it's about presenting now in terms of how quickly you might need to respond, you might have to stand up that board very quickly or have some delegated authority to the chair or whatever it might be in a fast-moving situation. But I guess the principle is that what you need is a really clear case for some sort of more restrictive action, like a lockdown, whatever that might look like, depending on the risk that was in front of you. But we would have a process of quickly getting agreement on that and having a clear logic for why that was the appropriate thing to do. Back to the Leicester thing, they're at the moment wrestling with what is the right thing to do. Now, I'm not involved in that, but it seems like they're also trying to be really sure about what the information is telling them before they make any definitive actions. So I think that's an ongoing situation based on the comments made by the Mayor of Leicester, that they're looking to get that level of understanding. So it is about that evidence-led decision-making rather than just moving to a decision.
And of course, we were very aware of that when we were going through our own local outbreak, that it was a very evidence-led approach. And that's where I think the colleagues at Public Health England and even national colleagues were incredibly helpful in terms of bouncing that data off each other, providing that analytical skills that you talked about earlier. But clearly, local leadership is key, and the local leadership of our democratically elected councillors is critical in that space, and we would recognise that. A final question, I think, on lockdown itself. If we had to go into a local lockdown for a geographical area affecting all or part of North Somerset, how would the perimeter of the affected area be managed? And I think that's a great question, because it's one I've asked myself. And I think, the reality is, I don't think it's clear. I personally don't think we've got sufficient resources with our local police to be able to support that. I'm sure they would need to be mobilised in the event of a serious outbreak, but even then I think they would argue it's probably insufficient. So this feels like going back to your governance chart, and I'm sorry to keep bringing us back to that, but there is the response, the incident response. And this may be where actually quite often in major incidences you do see the likes of the army getting involved. So I think if it was a very serious lockdown, we would have to call on additional resources maybe beyond our own area. So I don't know whether that's been discussed as DPHs, but certainly as chief execs regionally, we've recognised this is a necessary part of potentially having to escalate and do mutual aid, support each other in the midst of a crisis. So I don't know whether you've got any more information than that, but it seems quite speculative at the minute, because we can't, of course, point to an existing physical lockdown.
No,
but I think that's the challenge, is the enforcement side.
The only thing I can sort of reflect back on is something which I was involved in, was the foot and mouth outbreak, and about the physical restrictions to certain geographic places that had to be put in place as part of the effective response to that. It's not exactly the same, but those principles sort of apply, and the significant change point in doing some of that was when the army got involved, because that was deemed appropriate at that point for that to happen. Now, whether we have to adopt the same strategy in this case, I'm not sure. You could be doing it through signage and consent rather than active policing, if you like, in the broader sense. So I think there's a bit of testing to go on now over the next few weeks and months, depending on how the pandemic progresses, to see whether, some more significant resources need to be made available for that type of more proactive and policed approach to restricting access. But I think that's part of a national debate rather than just one for us locally.
Absolutely, and I think there is a really big national debate at the moment about us all as individuals in society doing the right thing, going back to those messages that you keep reminding us of around personal hygiene, social distancing, etc. So I think in the event of an outbreak, that's where that community leadership, that engagement with the public and that dialogue around doing the right thing in the event of the outbreak is probably the place we will land more than a physical barrier of sorts with enforcement. A great question about who's approving the plan, and people are obviously concerned that it's the first they've heard of it. So I suppose maybe we start with the fact that this is something we have to do by the end of July. We had very short notice to do it, and we are following the guidance in the way in which we've prepared it. But in terms of approving the plan?
So I think that's because of the timing is the challenge in this, in terms of our engagement board is going to be our parent for the plan, if you like. So ultimately our first meeting of the engagement board will officially own it from that point onwards. But what we have done through this process today and trying to get some comments and feedback to sharpen up what it looks like, we've also put it through our corporate leadership team, the executive as well. We've worked through our health protection board, so that's more of the operational response, that's multi-agency process. So we've tried to use a number of routes to draw in views and opinions about what the plan needs to look like, and then ultimately it will go to the engagement board to own from its first meeting. So that's where the overall approval, but we will need to publish tomorrow so that we meet the deadline set for us by government.
And just to reassure people as well, it's an evolving plan, so it's not a plan that we publish tomorrow and that's it. So we will be evolving it as time goes on, and particularly because obviously we're living through a pandemic, so there will be learning that comes through other people's experiences that we will want to embody in the plan. So it will be very much a live document on the website. So just to reassure people, it isn't something that's just going to sit there and not evolve. So we get lots of chances to evolve it on. Great question about money, of course. Are there sufficient funds and resources to respond to an outbreak?
So we have received money from national government. Each local authority, each upper tier local authorities receive money to support the implementation of the plan. What we're looking at the moment is to how to coordinate our resources alongside some of the existing resources and new resources that are being put in place. So, for example, talked about the health protection team at regional level in Public Health England. That's a significant resource and has been grown in recent times. So we're looking at how we can make best use of that. We've got the National Test and Trace system. That's another resource. So it is about trying to work out how to use that resource most effectively. And also, I think in a local area, it's about making sure that it's reasonably flexible so that we can respond to a range of different scenarios in the most effective way. So I would see that as not only providing specialist health protection support, which would sit more within my team, but it's also about our comms support. It's about the business intelligence we need to underpin the work that we need to do. It's about what can we do around community engagement. There's a whole range of ways in which we want to be able to not just respond to an outbreak, but do as much prevention as we can as well. And I think, for example, we've had that where we've worked with Serona to provide additional support for early years and school settings. So we have some resources. We'll be looking, because we've had the speed at which we have to develop this plan, the resource plan will come a bit later. We're already looking at how we can use that additional monies most effectively. But we also need to think about the pandemic being a potentially quite a long-term commitment. As we've learned already, it's definitely the marathon, not the sprint. We're moving through into another stage now. We could have another stage in the winter and then another stage after that. So we've got to think about how those resources, what are our responsibilities and how long will they last? And then we'll make a bit of a plan for that. But that additional resource is welcome, definitely. But we'll need to see in the long run about whether that's enough for us to be able to do everything that we need to do.
And moving now on to kind of questions linked back to the community, How do we, as we ease out of lockdown, how do we help the local support groups be ready for quick action to help communities in the event of a local outbreak? So that's Councillor Gibbons asking that question. So,
yeah. So I think a lot of that is, building on the learning, the really great learning we've had over the last few months in the North Somerset Together experience. The way in which the community action has been mobilised, and that has just been fantastic, and that has been that's something that not only protects health and well-being, that improves health and well-being, and that's a really good place to be in. So thinking about recovery and renewal, it's about how do we provide structures around individuals, wrap around people to support their needs more effectively. So I think, and talking about the resources there, so it's also, I mentioned a bit about community development, so it's also about how do we do as much as we can in that space to make sure that the right resources and materials are there for our colleagues in the voluntary and community sector to be able to use within their networks, to use within different settings and groups. So I think that's going to be an ongoing dialogue about understanding where are the opportunities and how can we get the right resources in the right place to be able to make that as effective as possible. So I think that will be, and also working with our elected members as well, who will have a really good sense of what's going on in their community and where the opportunities are. So I think that's something that will evolve over time. We'll get a bigger and better picture of where those opportunities are to do things better. But the principle is set really helpfully around the North Somerset Together work, is that we're going to do everything we can to try and empower communities and put resources alongside them so they can do what they do so well, which is know their local people and support them in the right way.
and I think that you've touched on it, but Claire from Vans has asked about what role Public Health and North Somerset Council sees the voluntary sector playing with the plan, and how will we engage with the sector in North Somerset. So I think in part, possibly through North Somerset Together, but events like this as well. Claire, obviously we had a broader invite than just our own councillors, recognising the fabulous work that's gone on through North Somerset Together. But do you see more of a role for the voluntary sector as the plan evolves?
Well, I think, like I've said, I mean, it is about protecting health and well-being, but it's thinking longer term about better health and well-being in our communities and recognising that we've got real inequalities in North Somerset. And COVID-19 will reflect some of those inequalities and exacerbate them as well. So from my point of view, I'd be very happy to continue to meet with and work with colleagues in the voluntary sector to think through, okay, so what have we learned so far and what are the things we could do better? So I think, we can use the established communication channels and any additional seminars or discussion opportunities. Got things like the North Somerset Wellbeing Collective now established, which is taking a really good coordination and leadership role around bringing together different agencies across North Somerset. So I'd say let's just keep talking about that, and we'll work together and try and think about not just the here and now, but the long term, about where some of the benefits are for health and wellbeing in North Somerset.
Great. And then I think the next question is about the college reopening for people to complete courses and training, so allowing people to get back to work. So just to reassure you, I'm in regular contact with the college, and I know the college have done a fantastic job of moving an awful lot of their training materials online, so they are still doing virtual courses and training. Of course, some of them probably do require you being on site because some of them are much more interactive, particularly on their new site. However, I know that they're actively looking at how they can prepare for September in the same way as all our schools are as well, because obviously the college is one of a number of senior school providers, as well as doing broader courses and training. So absolutely, they continue to provide online, but are also looking at that September start date. Next question here is about financial help for those who are shielding. So shielding, of course, has been very interesting announcements over the last week around what's happening to those who are shielded, and that scheme obviously coming to an end very soon. However, if anybody is asked through the contact trace system to isolate for 14 days, then there is an element of shielding, I guess, that's required. And so in terms of financial help, I would have thought it's It's very much around emergency help as and when, or using the use of community groups again in terms of support. And there is a hardship fund that the council has as well. So I think there are multiple ways for people who are struggling financially. I think looking at the national scheme ending soon, there is an expectation that people become more self-sufficient, obviously where they can, but with our support through the next phase. So I think that answers that question. The fear, so Councillor Cherry asking about the concern, I suppose, that so many agencies are involved, that there's a danger that we don't act quick enough. And then a kind of a question around whether the National Public Health England and also the JBS will be able to override our local decision making.
So I suppose I'd see that as funneling down, if you were like focusing into our place. So if it's about our area and our locality, the reason for having these plans is saying so it's owned by the place. So I think we are back to who owns the plan and who's the sort of whose jurisdiction is this happening. It is ours. Now, we would obviously, as it always is in these situations where you have a sort of major incident, there is a certain amount of dialogue up and down. But I think it is about us representing the needs of our community, the needs of our local population, and making sure that the right things are in place to do the right thing by our local population. I would see those tiers at regional and national level as being support functions for effective decision making locally. Now, we'll want to make sure that's done in a context and that it's with support ideally, and because we'll want to bring in resources from all kinds of places to help us. But really, we will make decisions, I think, based on what our local population needs are. And because that's the right thing to do. If there's risk, we need to go and manage risk and deal with it effectively. And if that's about moving quickly, then that's what we'll need to do, just to make sure that we are, putting our resources in the right place as quickly as possible. So I can understand the context for that, but I suppose I'd give a level of assurance that if we need to act, we will.
And I just want to echo that assurance and say Matt and I found ourselves in one or two very interesting meetings through the local outbreak that we had with some senior national figures. And I think as long as we could explain what was happening, be very clear about the evidence that we had, what action we were taking, as to provide confidence around our local leadership, I think that was the key part of us actually retaining that ownership as well. The next question is actually about, I suppose, transmission to a degree. So given that we obviously have health workers, care workers, and you could broaden that out actually to a lot of different types of workers who maybe live in one part of the footprint but actually work maybe elsewhere. So there's movement.
Yeah.
I think there's a question, but particularly, I guess, for care, health workers, doctors, nurses, can there be systematic follow-through to avoid community spread?
Yeah, so I suppose what you have there is that's about using the guidance that's developed for safe working and trying to prevent spread in the settings that you're working in. So if you have maintained an appropriate barrier of PPE, if you do appropriate social distancing, if you follow all the guidelines, then you are minimising to virtually nothing or nothing the risk of infection being spread in that setting. And then when you finish working in that environment, it's about following the same processes to take off that equipment and to safely return to your home, shower, all those sorts of things, which will then provide a barrier to that being spread anywhere else. So I suppose a lot of that is about making sure that people don't forget to recognise that they move between places, just like, if I have to go and do the weekly shop, systematically come in and wash your hands carefully and make sure that you've not touched anything else before you've done that process, so that you're reducing risk of bringing in the virus through touching a shared surface in a supermarket environment. So it's about being really conscious everywhere you go, not just through work, but through social activity, even if you're meeting somebody socially distanced in a space. If you sat on a bench in a public space, have you touched the arms on the bench? It's just keeping that constant alert in your head about what am I doing, what was the risk, trying to change your behaviours and just make that automatic then.
And in terms of the spread, I suppose test and trace is helping to do that as well now. So it's identifying where people have been, and then if they've been in another place and they may have put someone else at risk, if you can capture that individual before then they go on to meet other people, then that's going to be an effective way of trying to reduce the risk of transmission. But it is about your own individual behaviour. If you think about the setting you're in, what's appropriate for the setting you're in, and follow the sort of good practice routinely, then hopefully, and that is the most effective way of trying to stop the transmission of the virus.
So much of it seems to be about behaviour, doesn't it? And really challenging at the moment as we start to unlock. There is that sense, and I don't think it's even just a generational sense that some people may think it's all over, and of course it's so not. So really, really important, going back to that community leadership, trying to get those key messages across, really important. And the very last isn't really a question, it's more of a statement, but I think just if we unpick it a little bit, it's an interesting statement in so much as test and trace is far too open to vindictive abuse. I do hear there's quite a lot of concern, certainly around test and trace, and certainly when the app was talked about or is talked about, people concerned about Big Brother watching them, etc. I don't know whether you've got a view on that, Matt.
Well, I think it's the same with anything. You get it in any communicable disease outbreak, and you see it where individuals need to explain who they've been in contact with and what's happened. And as with any of those situations, some people will use them totally honestly and in good spirit, and some people may have more of an agenda in the way they use them. I would hope that that is in the vast minority of actions, but I don't think if there's one or two people who are using it in the wrong way, I don't think that should distract us from the fact that it's the thing that we should be doing. We should be responding positively to it, because as long as you can, talk honestly about where you've been and what you've done, then there should be no problem in that. It'll always be that, in the same way that we're seeing about in terms of behaviours changing now for some people who you may think are behaving in a way that's not appropriate. It's difficult, but all you can do is take responsibility for yourself, I suppose, and the people that you live with and the environment that you can control. So if we all think about it in more of a positive way and a I'll do my bit way, I think that's the best way to go about it. And recognising there will be issues along the way, but generally I think the vast majority of people are desperate to not lose the gains that we've got over the last few weeks, to keep going in the same way, and to, and are desperately keen to try and protect people, whether that's their family, their friends or their neighbours. We want to see everybody come out of this in the best way possible, and we care deeply for the people in our community. So sometimes it might feel a little inconvenient or a little bit frustrating or annoying or whatever, but actually if we stick with it, we'll come out all the better for it.
So I think that's a great way to end, actually. So a huge thank you to all of you watching. We need your support in terms of moving forwards, because it's only by working together to get some of those key messages that Matt's ended on out is really important. So that those personal hygiene messages, hand washing, sanitizer, also social distancing. I feel like I'm being tested now. Have I missed any?
And then it's just about, so if you think you've got any symptoms at all, no matter how mild, then you go to NHS 111, use the online process, and then if you need to, you can get yourself a test. So don't be afraid to, because it can be quite hard to spot sometimes. You might just feel a bit lethargic, a bit run down. It could be the signs, because it's quite mild in some people. So don't be afraid to use that system. And then if you can do, there is capacity for testing. We have capacity locally for people to be able to use that, both at Locking Road and as of tomorrow from the site in Clevedon. So put yourself forward, and then don't be afraid to go again and again if that's what you need to do, just to try and make sure that you're doing everything you can not to spread the virus.
That's great. And just a quick reminder on your last slide, I think, I was just looking for the website link. So tomorrow it'll be published on...
Yes, if you go to the North Somerset Main Council website, which is
local-somerset.gov.uk, and there's a banner at the top which gives everything around coronavirus. So if you follow that banner, it's in yellow with blue writing, I think, at the top of the website. That'll take you through and you'll be able to look up the plan from there.
Yeah, and I think the key search words are LOMP for Local Outbreak Management Plan. So thank you all very much.